here. I'm going to talk to you a little bit about vaginoplasty, both surgical and non-surgical. First of all, what is a vaginoplasty? Plasty just means tightening or repairing. So vaginoplasty is repairing the damage from childbirth to create a tighter vagina. Now, why would we want to do that? For some of us, that improves friction with intercourse. So if you're happy with your sex life and there's nothing wrong, nobody needs to have this done. That's a common question. Do I need to have it done? Absolutely not. There's nothing wrong with you the way you are unless it's something that you want to fix for your own personal self-esteem and sexual enjoyment. So for some of us, when we've had vaginal deliveries, and I have 3 kids myself, obviously all of us experience some vaginal relaxation after pushing a baby's head through the vagina. There's no way to avoid it. It does not go back to normal. We can do some non-surgical things like Kegel exercises. We know what those are, right, ladies? Just tightening those pelvic floor muscles. But sometimes we can still feel that looseness is preventing us from having the maximum sexual pleasure that we desire. So tightening the vagina can be done surgically. A lot of patients ask how that's done. I have a little model here of a rather small person. This is her vagina. But the way the surgery is done is that we, first of all, put you to sleep so you won't feel any pain. And an incision's made all the way up the back of the vagina, all the way to, this is where the patient's uterus is, all the way up to the cervix. That tissue is then peeled back to reveal the muscle plate underneath. Now those muscles, when we were, here's our vagina, top and bottom if you're laying down. Those muscles when we were younger were nice and tight. When we have a baby, the muscles get stretched. So when you have surgery, I find those muscles and pull them back together. And you can see how that tightens the vagina just by pulling those muscles together. Similar to if we had a tummy tuck or any other muscle tightening procedure. Once those muscles are tightened together, then there's some excess vaginal tissue that's trimmed away and it's sewn back up again. On the outside, all you see is a little line, kind of like an episiotomy scar. But on the inside, those muscles are actually pulled together all the way up to the cervix. In most cases, it's only that posterior side, or the side closest to the rectum, back here, that needs to be repaired. In some cases, that anterior side, or the top side, which is closest to the bladder, also needs to be repaired in the same way, so that those muscles are pulled together. So we can achieve whatever amount of tightening that we need in order for that particular patient to have her normal anatomy restored. So there's no goal of making us too tight or anything abnormal. It's simply a matter of restoring the anatomy as much as possible to a pre-childbirth state. So that describes surgical vaginoplasty, which is a real surgery with about a 6-week recovery. Pain for 1 to 2 weeks, it's something to take very seriously. I have patients who've had a tummy tuck and a vaginoplasty, and they may describe the pain to be quite similar. It works really well, but it is a surgery to take a lot of care and thought in, and to make sure you see a surgeon who's very experienced in vaginal surgery. So this is not something that you would want to have a regular cosmetic surgeon do, but certainly a very experienced vaginal gynecologist who's been doing this for many, many years, like myself. I also want to talk to you about non-surgical vaginoplasty. There are some methods to tighten the vagina which don't involve surgery. The one that I recommend that we use in our office is called Thermiva. It uses a little heating element. The probe is about the size of my finger. This is done without anesthesia in the office. The probe is entered into the vagina, run back and forth so that we don't burn you for about 20 minutes within the inside of the vagina. And what that does is causes some microscopic damage to the tissue, and new collagen comes in to heal the tissue. And you can imagine if more collagen's placed, it just kind of tightens the vagina a little bit so that it gives it a more puffy, kind of youthful feel. I actually had this done myself, and I did notice a slight improvement. It's not a significant improvement that you would see with surgery, but a slight improvement, definitely enough to make a difference. And it also can increase sexual sensation because we're working right underneath the clitoris, and a lot of blood flow comes in to restore blood flow to the clitoris for women who are especially over 45. So that's a little bit about surgical and non-surgical vaginoplasty. We look forward to talking to you about it here in the office.